So thank you everyone for joining the next session of our course on skin through OIAH. And as you all know, that last class was done by Dr. Hira Aggarwal, and we all benefited.
1 minute, can you excuse me?
Yes, sir.
Two of my students of the clinic want to attend. Can they attend? Two of my clinic assistants want to attend this. Shall I send them, or can they attend or not?
Yes, sir. For today's session, you can send them.
Only today, Baba.
Yes, sir. Yes, sir.
Okay. Thank you.
Yes. So we all had heard a few words from Dr. Hiralal from his ocean of experience. So today we'll be able to get few more things from his experience, and let's see what he has to say. His main concentration today will be on the medicines which we are using, or which should use and concentrate on while dealing with the cases of eczema and other major skin problems. So I would put the mic to sir. Sir, mic to you. Yeah, Dr. Deepak, sir, slide is with you. You can start with the screen sharing.
Should we? Today's I do not have any PowerPoint from sir. So okay. I already allowed to share his screen.
Okay, thank you. Yep. So you can start sharing your screen, and yes, sir. Yes, sir. Any help needed, sir? Yes, sir. You can start, sir.
Hello, I'm Akash, sir's assistant. Actually, sir is in washroom. Sir is coming. Can you wait for 5 minutes?
Okay, sure. No issues.
Yeah, thank you.
Okay. Meanwhile, when sir is joining, I would like to tell few of the things which I would like to share during these sessions. So as last time we have discussed a little bit about the warts and few medicines which are useful in warts. Today, let us talk about a little bit information about the discoloration of the nails. So as we all know that nails are the appendages of the skin. They are the extensions of the skin. They are the accumulation of the dead cells of the skin. So nails are also one of the mirrors which can give us a lot of idea about what's happening in our whole body. So it's not only the kind of the appearance they are having, even the slight changes in the color of the nail can give us an idea about various health issues which we might be suffering from. Like for example, if someone is presenting with blue nails. So as we all know, blue color is the demonstration that our body is not getting enough oxygen. So the same appearance gives from the nail also, that if our nails have turned blue because of some reason, that means there is not enough oxygen supply in our bloodstream. Nails, since they are white in color, and white color is the mirror, it tells us many ideas. So by the blue nail of the blue nails, we get an idea that our body is not getting enough oxygen. So by this, we can find out what are the underlying reasons why oxygen is not getting transported in the bloodstream. If our nails, which are usually off-white in color, if they become very white, completely white, as if they have been painted in white color, that is usually an indication of people having either liver diseases or people having diabetes. And diabetes also, that is an uncontrolled blood sugar level from many days. If the nails become pale in color, that is an indication of anemia. If the nails are giving an appearance of they are half pink and half white, that is a clear-cut indication that the person is suffering from some kidney diseases. If because of some reason the nails turn yellow, that shows nails are having some infection or there is some underlying lung diseases happening. So apart from that, if we see some blue half moons in the lower bed of the nail, that is a sign of some poisoning happened. Either it's acute poisoning or there are some things which are regularly being intaken by the person which is not suiting. So that's a sign of poisoning for the person. If there is an appearance of dusky red half moons present in the lower bed, again, that could be because of some heart disorders, or it could be because of arthritis, or it could be because of alopecia, or it could be because of lupus. So the color of the nail has given us a lot of indications, and it will help us in diagnosis of what disease, what underlying disorder, or what health problem the person is suffering from. So whenever any patient approaches us, especially for some chronic disorders, then we should definitely look for the color and the appearance of the nail so that we can get a little idea that what could be the underlying disease which they are suffering from. And in homeopathy, based on these colors, we are having very good medications, like we are having Silesia, we have Calcarea fos, there is a very good medicine like Racimosa, and we are having very good medicines like acid nitricum, Urtica urens. All these are very good medicines that help in curing some or the other nail colors. But again, we have to look for the other underlying symptoms. So this is what I want to discuss a little bit about the color of the nails that can be helpful for our diagnosis. So is Dr. Hira ready, sir?
Yes.
Yes, sir.
Am I audible?
Yes, sir. It's audible for everyone. I hope everyone can hear, sir.
Hello. Good evening, everybody.
Yeah.
So today is our second part as we are going ahead with skin and homeopathy. As discussed last time, we will go to the topic of this time eczema, and homeopathy. We'll see some situation for eczema. What happened? Okay, so a small, I think, discussion of eczema we will do, or also known as dermatitis, which is known as the inflammation of the skin, typically characterized by itchiness, redness, and rash. In cases of short duration, there may be small blisters, while in a long-term cases, the skin may be thickened, as you see in the photograph. Now, these are many cases that we come across eczema in our day-to-day practice, and dermatitis is also called as eczema. Dermatitis is inflammation of the skin. Any itis is called as inflammation. So skin inflammation is dermatitis, which is often called as eczema. So there are different types of eczema: atopic dermatitis, allergic contact dermatitis, irritant contact dermatitis, seborrheic status. Less common types are dyshidrosis, venous discoid, herpetiformis, neurodermatitis, autoexematization, and viral. Again, as we saw in psoriasis last time, skin conditions are very difficult to treat because they take a long time to treat. It's a time-consuming situation. But the problem here is the irritation that is there, which makes the person lot of psychic trauma as well as physical trauma of itching. They lose their sleep, and the itching is mostly at night, and it becomes a very social difficulty to itch in the daytime or in a social situation. So that way, if you see, there is no life-threatening situation. In some cases, there is a life-threatening situation, but in majority of the skin conditions, you have very little chances of life-threatening situation. So, but it is very difficult for the people to stay over with it. Atopic dermatitis, also known as atopic eczema, is a long-term type of inflammation of the skin. It results in itchy, red, swollen, and cracked skin. Clear fluid may come from the affected areas, which often thickens over time. So you have a lot of thickening. But how will you differentiate between the thickness of psoriasis and the thickness of eczema? So more in psoriasis, you have the scaling or discoloration, which is there, which is a typical hallmark, and the shiny skin. All these families come with, you have to also differentiate lichen planus here. If you see lichen planus, they are shiny eruptions, which are there, much of shiny eruptions and without discoloration. While in eczema, it is more dry, scaly, and lot of itching. But the scales don't come, the skin does not come out in eczema. So it's a very close differentiation between psoriasis and eczema. And atopic dermatitis are mostly in the folds of the skin, like the arms, the cubital fossa, the hollow of the knee, inguinal region. All these are the seat for atopic dermatitis. Cause in all these situations, they say it's unknown. Genetics involved or immune dysfunction is involved. Environmental exposures, difficulties with permeability of the skin, sensitivity of skin. Many people have sensitive skin. They have sunburns, or when they use this artificial jewelry, the skin becomes very irritant. So this sensitivity of the skin is also there. So these are the seats of action, various seats that you see, skin folds. Here, when you see folds of skin, you have very strong remedies. Graphite is one of them. You'll have to think of. This is how you come to your differentiation of remedies. So these are localizations of various locations for atopic dermatitis. So people with atopic dermatitis often have dry and scaly skin that spans the entire body except perhaps the diaper area, and intensely itchy, red, splotchy, raised lesion to form bends in the arms or legs, face, and neck. Atopic dermatitis commonly affects the eyelids with signs of denim organ infraorbital fold, infraauricular fissure in the ears, and periorbital pigmentation can also be seen. Post-inflammatory hyperpigmentation on the neck gives classic dirty neck appearance. Lichenification, excoriation, and erosion or crust on the trunk may indicate secondary infection. So secondary infection are mostly seen in eczemas. You have pus coming out, you have fever with that, you have inguinal nodes. So secondary infection is very common in all type of dermatitis or eczemas. Flexual distribution with ill-defined, with or without on the wrist, finger, knuckles, ankle. Evidence indicate genetic, environmental, immunological, but from our point of view, it is mostly psychosomatic. Now, allergic dermatitis, as the name suggests, it is some sort of allergy that you see in allergic dermatitis. Irritant contact dermatitis. There is some sort of irritant. Nowadays, during this COVID phase, you use a lot of sanitizer. So contact dermatitis or irritant contact dermatitis is seen. Signs and symptoms, as you see, these are all, I'm just going fast through it because we have to learn more with our medications. The symptoms of allergic contact dermatitis are very similar to those one caused by irritant contact dermatitis. It's very hard to diagnose. Just hang on.
Dr. Bharat has said that he is unable to hear you, Dr. Hiralal. Is it the case with others as well, or are you all able to hear him?
Is it okay?
Yeah, so for me, it's fine. I can hear you.
What about others?
Now okay, sir. Now okay.
It's okay.
Yeah, they said that now it's better. They can hear you.
Just hang on. Huh? So here you have allergic contact dermatitis. The symptoms of allergic contact dermatitis are very similar to one caused by irritant contact dermatitis. These are very common or clear situations, like the ladies working in kitchen, they have allergy to, they use the acids or they use the detergents. So all these are allergic contact dermatitis or irritant contact dermatitis. What you will see is the redness of the skin, the irritation of the skin, and itching, and also possibly there may be papules, blisters or vesicles, or even a simple red area. Why it is blocked? You block you or okay. Just give me 5 minutes.
Yes, Dr. Muzammil had asked that if there is a right thumb having a bluish or a purple color, what could we suspect? I think we can suspect rheumatoid arthritis. or oxygen level should be checked. These are the two things which are coming in my mind, which I think can be the result because of which the right thumb is having the blue color.
Yes. I had forgotten to add cases. So I'm just adding the cases from the other computer. Sorry for that. What was the question? Somebody asked a question.
So the question is that how to differentiate seborrheic dermatitis, that is dandruff, and psoriasis.
Now, initially, with a very initially phase, what you see, they come as seborrheic dermatitis only. They come as dandruff only. But they are very simple, thin scaling that is for formation there. But as the time goes on, there are relapses. And you see that rather than dandruff, the skin becomes more thick and you get flakes of skin coming up. Now there are flaky skin. A lot of skin flakes are coming and the area is increased. When you see flaky skin and areas increase, then it is more towards psoriasis rather than dandruff. Flaky skin, you will not see the dandruff. Small drops or small white flakes are not there, but you get a big flakes of skin that are coming up. And chronicity, two things. The third may be, if it is psoriasis, there may be some more eruptions on the other part of the body. That is a confirmation, but only in the scalp, the flakes of the skin becomes more big. That is how you will have to understand. Now, seborrheic dermatitis sometimes inaccurately referred. I'm just setting the cases. Just give me 2 minutes.
Is anyone having any other questions? Please put it in the chat box related to nails also, all related to the skin eczema, which sir is discussing, atopic dermatitis. We can discuss that meanwhile when, okay, I think sir is there with his cases.
I'm sorry to be a little bit interrupted because the cases are so okay. Now we come to seborrheic dermatitis, sometimes inaccurately referred to as seborrhea. The question just asked by Muzambil is a long-term skin disorder. Symptoms include red, scaly, greasy, itchy, and inflamed skin. Areas of the skin rich in oil-producing glands are often affected, including the scalp, face, and chest. It can result in social or self-esteem problems. Now, the causes of seborrheic dermatitis have not been fully clarified. In many of the skin conditions, the causes are unknown. That is the most difficult part. In addition to the presence of mesothelioma, genetic environment, hormonal and immune system factors are necessary for and to modulate the expression of seborrheic dermatitis. Now, the next is statice dermatitis. May be characterized by skin that appears thin, brown, and tissue-like with possible skin lesions, macule or patches, red spots, superficial skin irritation, and darkening and or thickening of the skin at the ankles or legs. Stasis itself means that it's a stasis of the blood system or venous system. And wherever there is a stasis, mostly with the venous stasis, you will get this dermatitis coming up. That is called as venous eczema or status eczema. Then you have open sores or ulcers, itching or leg pains. Sometimes pain may persist from swollen tissues and may feel like stabbing or pricking of needle. This is mostly seen with people sit for long hours or who have a sitting job and they have a little bit of obesity, or they have varicose veins, varicose ulcers or varicose veins on the lower limb, cause of status dermatitis. If skin continues to deteriorate and break down, a venous ulcer known as a status ulcer may form. Without proper wound care, open crack predispose patient for the entry of a bacterial infection causing cellulitis in the leg. So here, the ulcer is similar to be treated with venous ulcer. So the treatment for varicose veins ulcer or venous ulcer is the same as you treat here. Now here you can see in the picture, stasis ulcer or status dermatitis. Gravitational eczema also is called as. Again, the cause unknown, but a combination of genetic and environmental factors. But obesity, laxity, post-delivery situations, all these things cause whatever causes for venous congestion is seen or varicose veins are seen, there you get such venous dermatitis or status dermatitis. Now, most of the dermatitis, by the look itself, many of the skin conditions are diagnosed by the look, the location, the type, and the presentation of the skin confirms that this is the disease. But in many cases where the diagnosis is difficult, they go into an histopathological classification. And for eczema, they can do a histopathological diagnosis also. And these are the various histopathological classifications, which I would not go into details because they are difficult for us to understand, and that is not our area of understanding also. We should know that many cases we should go into a histopathology situation where it is difficult to classify. And whenever we are doing some research, then histopathological diagnosis is very important. Now we'll see the homeopathic view. Before going to homeopathic view, we will see some cases. Now, you have this case of eczema, which was a weeping eczema. Now, types of eczema, what we saw is weeping eczema or dry eczema. So many a times it is dry, but many a times it is weeping. It may not be a secondary infection, but it is a type that is weeping. Here you see a lot of discharge, which is serous discharge, which is going out. And this is the girl who was suffering very badly or terribly with this eruption on both of her legs. Many of the remedies were given. Initially, she took allopathy, but was very bad. She came to us in this difficult situation. And the remedy already is written here, sulfur. But we're afraid to give sulfur. The thing is, we are afraid to give sulfur. Sulfur, we say that it works both ways, centrifugally and centripetally. Whenever it throws out more of the suppressions of skin which was done before. And that is why we fear giving sulfur. But if you go to the philosophy, if you read your philosophy and the philosophy is clear, and if your materia medica is clear, we will not hesitate to give sulfur when sulfur is clearly indicated. You have to give sulfur. Here it was a very difficult situation. Again, she was to appear an exam, and if there was an aggravation, it was very difficult for her to go for the exam. But somehow sulfur 201 m helped her out, and you can see the situation which was much better, and she could go for examination. Why sulfur? Again, adhering our materia medica. Here materia medica comes us to play. And how we have to confirm the remedy? The more confirmed our remedy, the more confident we are in giving our remedy. So giving our remedy with confidence only comes when our materia medica is very clear. And with that, you have to support your confidence with the philosophy. When you see very clearly what is happening in the case, and this is how case taking is important, because we have to analyze how things started. In all conditions of skin, you have to see the origin or cause of how it started. Now, in allergic cases, you see, I come in contact with the detergents. They are working in chemical factory. They are working with chemical industries, or they are using latex rubber for working the gloves or the gum boots. All these things have to be understood. Farmers working in the farms, they have working with the fertilizers. They spray. So these people come with a lot of reaction or rash on the body, which is sometimes very fatal, and they scum down or die also with that chemicals. So reactivity is so strong of the skin. So here case taking to be noted is the cause, how it started, when it started. If there is no physical cause, then you have to go through and understand the mental emotional situation. So this girl was helped by sulfur because of her generalities of sulfur. If you are having very clear symptoms of sulfur, the generalities and the modalities of sulfur, you should not hesitate in giving sulfur. But what caution you have to take care here is the potency of sulfur. So whenever we are in a dilemma or we are not very confident, we should not go very high, but 200 is quite sufficient high to start with the case, and we should wait. In case of aggravation, mostly in skin cases, there is definitely an aggravation. There is a little bit of push or rise in the skin symptoms, and then there is a decrease in skin. As we discussed last time, we have to analyze or find the difference between the medicinal aggravation and the disease aggravation. And if you can correlate that and clarify that, you just have to do nothing, give placebos, and the patient will be better in that particular week. So if you see the next one, fibromatosis of the right thigh with eczema. She had fibromatosis. You see, the whole leg was having the eczema, which was oozing. Then it became dry, and then finally she came out of this eczematous situation. But what was important here was she had a fibromatosis of the right thigh, and during the medication. Now here medication also is important. One point to be noted is post-medication dermatitis. People come with a lot of medication, allopathic medication, and they come out with skin situation. So this is where you have to think of medicinal or iatrogenic diseases. That also is an important situation here. Eczema in a child, infantile eczema. Eczema in child is called as infantile eczema. Now, these eczemas are mostly on the legs, face, and they are more oozing also. Here, calcarea, you see the child, calcarea, as you know, you have to have that calcarea with child. Sweating should be there. What is calcarea? Important is sweating in the head. sweating at night, sweating during eating, fears, fear of dark, fear of alone, fear of animals, fear of domestic animals. So all these multiple fears are there. Craving for milk, craving for sweets. What else? Wounds do not heal early. All these things should be there in Kalkarakar. So this is the child of Kalkarakar, which healed totally. Until today, he is better. Today is an engineer. He meets whenever he comes. And it took about 2 years of time to really clear him off. Now, this is another eczema. Here, in some seminar I was to give, we had written the remedy's name. Natramur, you see the eczema on the palms and soles. They are not eczema, but here also with eczema, he had secondary infection. There was a pus, lot of pus. You see in the fingers, pus were there. Then they dried out, and then now his was better. Now, why Natramur in this case? This was a case where we saw that he was working in railways, and with some issues, he was pushed to another department where there was a lot of financial loss. And due to his financial loss, he was in a lot of financial crunch. And this grief of financial crunch, which was unexpressed, he became more introvert. Then other things of Natramur like sun sensitivity, facial dryness, loss of sleep, headaches, all these came up. Aversion to fat, all these things should be taken care into, and Natramur helped him out through and through, where he's totally better till today. There are no relapses. You see, these are the cases where I still have their data or their touch, so that we know that what is their relapse. So long back, 4 or 5 years, still there is no relapse. Now, this is a very difficult case of eczema, again an oozing eczema. You can see he had mostly in the folds of skin, ankles, the cubital fossa, the fingers, and he troubled me a lot. There was a lot of oozing, lot of discharge, but he was very stiff. He did not go to anybody. He was nagging me day 1, day 2. We needed a lot of dressings done with calendula. He was doing at home also. But finally, with all the remedies given and failing and relapsing back, what came to the understanding was he had an aggravation of moon phases. Whenever there was waxing and waning of moon and full moon, that came to an understanding when we were seeing why you are aggravated, and finally, after a lot of filtration from various precipitative factors like food, environment, this and that, it came that it is more of new moon, full moon. And finally, silica did the job, and he is totally today after silica. So this is eczema aggravation. You see, series of
Your voice is breaking, sir.
Again, oh dear, why it is breaking? Now it's okay.
Yes, sir.
Hello.
Yes. Yes, sir. No.
Is it okay now?
Yeah, it's fine. So in between, it was breaking for some time.
That is, I think that is last time also the Wi-Fi situation is something not good.
Yes, sir.
So this was the case. So you have to also keep in mind the moon phases in many of our cases: epilepsy, asthma, headaches, migraines, irritability, psychological disturbances. Moon phases gives a very important, what we can say, an aggravating or ameliorating factor. It becomes a very good modality, which you have to keep in mind. Now again, an eczema of the fingers. This was a lady with contact dermatitis. She was working with detergents and all. So you see, especially in the fingers, that was there, and it came out, or she was much better after pulsatilla. Infantile eczema with albuminaria. Here you have with albuminaria also, you have the reports where there was albuminaria in this case, and cloudy, you see albumin 2+, and this child also responded well, and this was where he was better, and albuminaria also went away. So these are the things that we should keep in mind. Infantile eczema are a lot. That is why in pediatric age group, if you get this type of eczema, you can treat them. And pediatric groups, mostly calcarea carb is one of the best remedies. Calcarea sulf, whenever you have a lot of oozing or the discharge is pus like greenish. Calcarea sulf, one more thing is, whenever there is oozing of pus, which is very dirty, the facial look is dirty, and even in pimples, you see, the diagnosis does not matter. What matters is what is the symptom of the remedy, the peculiarity of the remedy, the peculiar discharge, the peculiar presentation, or the peculiar location. Now, when we talked about the location of the folds, graphites is one of the first remedy which is thought of. Now, what is graphites? If you want to confirm graphites, what are the things you will ask for? Anybody? If you want to, now when you see that the eruptions are in folds and you think of graphites, so what are the things you will ask? Anybody? What are the things you will ask for or see for or observe, so that you will confirm graphites?
Sir, we will check about the chilliness of the patient. Is the lesion dry, or is the lesion or the skin problem is too much dry? And I think so with constitution, it will be the fatty woman. No.
Yes, constitution, fat. What else? The eczema, whether it is dry or weeping, does not matter. You see, it does not matter. What matters is the folds. The location itself is giving you graphite. Whether it is dry or wet does not matter. What matter was obesity. What else? Good answer. Next, anybody else?
Sir, constipation.
Constipation. Very good. What next? Obesity, chilliness, constipation. What else?
No sweating, sir. No sweating.
Yes, no sweating. What else? If you add these three, no sweating, dry skin, obesity, constipation, you have other remedies also. But what is the peculiarity of graphites which will make you to clinch graphites? In obesity, calcarea carb will come. In
dryness,
calcarea carb is also there. Huh?
dryness,
Skin dryness, silica is also there. How will you clinch to graphites? Yes, some more. Shilpi had given you already and hint. She taught you before I started. Nails. Important in graphites are nails. Ingrowing toenails. Ingrowing toenails. One, they are very strong. Aversion to sweets, along with what we have discussed. Third is, if you look at their elbows, it will be thick and dry. The skin not only of graphites is dry, but it is thick. There is thickness. If you see the neck, the neck will be thick. You can't even see thickness, blackness, and dryness. This is graphites. The skin should be thick, black, and dry. They have three things in graphites: blackness, dryness, and thickness. Along with that, if you have the elbows black, thick, ingrowing toenails, aversion to sweets, and all the other things that we talked about, constipation, obesity, it is only graphites, nothing else. And if it is a non-vegetarian, what you will get? What does graphite like? Meat or does not like meat?
Does not like meat. Aversion.
Does not like meat, aversion to meat, fish, and desire for chicken. Strong desire for chicken. and aversion to salt. If you have to just fix up the remedies by asking these questions. But these are the specific you will have to observe for skin of graphites. The neck is very thick and very black. There are folds in the skin. ऐसा लेयर बन जाता है स्किन का. वो बोलते हैं नहाया नहीं करे तो कितने दिन से अगर उसको रगड़ते तो पूरा चमड़ी निकलेगा. इतना जाड़ा हो जाता है चमड़ी उसका. If you see the moment you see the skin of the neck, you see that thickness, and that is only graphites. Okay. So now we go to some of our remedies. These are some cases that I have shown you. Now, if you see, if you go to our repertory and see eczema, you have so many remedies. As you know, red color are 3 marks, blue are 2, in italics and 1 are so. So you see graphites has 4 marks. It has bold plus underline. Sulfur is 4, rust ox is 4, sorinum is 3. Tuberculinum, one of the best remedies. Now, once you see this, now the next part that you have to see, now you have so many remedies. What you have to see next is skin eczema accompanied by and sub-rubrics of eczema. What are the sub-rubrics? Acute. In acute, you have only 10 remedies. Now you come down to only 10 remedies. Out of 250 remedies you had in eczema, if it is an acute, like you can come with allergic dermatitis, acute situations, you have only 10. And what are those 10? Oh, I have this crotontic, I think. Last time I told you I will show you crotontic, है ना? Crotontic. You can see one more here. Now this is eczema around the areola. Eczema around the areola, and the only remedy that you see is anacardium. Anacardium is one of the remedies for eczema around the areola. The location is important here, not the mind. Nothing of anacardium is there, only the location. 1 mark remedy. Eczema, areoline, anacardium, and that cleared up the situation. Here you see vesicular eruption, proving of anacardium. You see, when you see the materia medica of this is a learning what we have seen, proving of anacardium. You see vesicular eruptions of anacardium. Now here is a case where it is a proving of anacardium. This was a lady who was pregnant, and because of the pregnancy, nobody should do a black magic. She had put a biba or the anacardium in her hand. She had tied her anacardium in the hand. Because of the wetness constantly working in water, she got this such sort of bulbs and swelling of the hand. And this was anacardium proving. And she was better after giving anacardium only. So this was a proving of anacardium. You see the sort of vesicles or bulbs of anacardium. This was a very good learning for me to understand eruption. And after anacardium, you see it dried out like this way. This is another skin reaction of anacardium. This was a professor in botany, and he was crushing anacardium. Due to those fumes of anacardium, he got that eruptions on the face, on the body. So many people are sensitive to anacardium as such. If they hold the anacardium also, they get a strong reaction. So this was anacardium. You see the way you can see during, and this is after. Sorry, no after, during only. So this was anacardium, which was a very good learning for me to understand how anacardium is. There is that. You see crotontic. You see, this is crotontic. I told you last time. If you see in the picture, this is the small vesicle it forms. And once the vesicle forms, it breaks open. and after it break open, it becomes a skin eruption like this. You see, it breaks open and you have an eruption which is coming like this. You see, it breaks open and you have a whole eczematous eruption which is there, which is burning, oozing, and all this thing. You see, after the vesicle breaks out, these are all crotontic eruptions. So what is crotontic? If you see the rubric also, I'm forgetting the rubric, exact rubric. Vesicle break open and form a eczematous patch. So this is crotontic. See, this is again eczema. Now you have psoriasis. So we will go to the other. So that is two things I wanted to show you. Anyhow, I had forgotten anacardium. So this was crotontic and this was anacardium. Anacardium, to keep in mind the eczema around the areola, very typical. And that is why when you go to our repertory, you have to see very clearly. In acute, you have only 10 remedies. What are they? Anacardium is there. Crotontic is there. We talked about the two remedies. Rustox. Rustox again is a very good remedy. You have a lot of symptoms of rustox in skin. Though we know rustox only for the musculoskeletal disorders. But if you see skin of rustox, it has all vesicular eruptions. Last time I told you in herpes zoster, it works very beautifully. It also has urticaria, herpes, psoriasis, itching. What is the important modalities? Better by hot water. Not only warm water, but hot water. Also arsenic and Rus verinata. Thickened skin in long-standing skin disorders. So Rustox is a very good remedy we have to think about in many of the skin disorders. You see, you also have atopic dermatitis, bathing in the sea and aggravation, childhood sins. So ailments from or complaints from, all these things to be taken into. So if you go through this, you will have much more understanding. Folds of skin, you have only two. Folds of skin, two remedies, tuberculum and a rare remedy, Monila albicans. Tuberculum is one of the remedy which is very frequently used with many of the skin situations. We will go ahead and find what are the importance of tuberculum. Gastric complaints with eczema, gastric complaints with. If you see you have to go through and see. You see, you have to play with your Bacteria medica and play with your repertory. The more you, and whenever the patient sits, you have to learn your repertory at that time, because you cannot learn your repertory other times. You have to learn the repertory at that time only. In gastric complaints, you have antimproved, iris, and lycopodium. Now, what is antimprovum? You have to go with the generalities of antimprovum. Iris versicolor, you know, iris versicolor also has vesicular eruptions a lot. But what is in skin of antimproved? Anybody can say the corns. The specific are the corns on the soles, the thickness of the skin, the hardness. Thickened hard skin is more of antimprovum with horny excrescences, mostly in the warts. Warts are very important for antimprovum also. So eczema accompanied by, you see accompanying symptom. What are they accompanied by? Accompanied by acid, accompanied by gout, accompanied by liver complaints. So these are very important, so that the whole of the eczema which was having 200 or 300 remedies, now you come down to 1 remedy or 2 remedies or 5 remedies or 10 remedies. When you say respiration asthmatic, you have eczema suppressed coming to asthma, or asthma suppressed coming to eczema. So this is the rubric you have to think of and find out. Even rheumatism, suppression of rheumatism, suppression of asthma coming to rheumatism, or rheumatism, asthma with. In psoriasis, we saw psoriasis has a complication as psoriasis arthritis. So you should learn your rubrics very clearly so that you should understand where you are going. Immediately your symptoms come to very few remedies which we are easy to differentiate with. Now here it is a very important one thing which I was learned to know was eczema in neurasthenic patients and neurotic patients. Who will differentiate the difference between neurasthenia and neurotic patient? What does it mean? Two different rubrics he has given. Anybody? Everybody is hearing me? Hello?
Yes, sir.
Oh, so all are quiet? There should be a discussion. Why everybody is quiet? Who will tell me the difference between neurasthenia and neurotic? Yes? मजा नहीं आएगा नहीं तो सिखाने में. If you want to learn, we have to have a exchange of talk, exchange of thinking, exchange of what you are perceiving or what you are thinking. No matter, I have not studied everything. I had a lot of failures. Many failures have brought me here today. So if you are wrong also, you should speak. Don't worry about being wrong.
Neurasthenic patient, neurasthenia is something related to irritability or headache or like moody patient.
Yes.
And neurotic is some kind of psychological illness. Yes.
Yes. Very good. Who else? Very good. Because unless and until you understand your rubric, how will you use the rubric? How will you utilize the rubric? If you have understood it correctly, you will put it very correctly. And the more correct you are in putting your rubrics, you see, there is a difference between analysis and evaluation. Now you are evaluating a person. So to which rubric you should give more importance to. So you have to understand your rubrics. What is important to understand is, you have to understand what it means to us. So neurotic, you said, is a psychological disorder. It is a disease. While neurasthenia is a drained out situation. Drained out from more of mental overexertion or physical exertion. There is no psychological disease or disorder. Mentally the person is very clear, but he is totally drained out, exhausted. Neurasthenia, sthenia is drained out. Neurologically means mentally. When they'll have a lot of mental overexertion and they are drained out, they are called as neurasthenic patients. And neurotic is somebody who has a psychological disease. And in both these cases, you see what is common is anacardium. In neurasthenic is more anacardium, 2 marks, while in neurotic it is 1 anacardium. What is the mind of anacardium? Who will tell me? How will you clinch anacardium?
Dual senses.
Yes.
Dual sensor, double-minded.
Double-minded.
One part is very good. Yeah.
Double-minded. Can you explain?
One part is very highly spiritual. One part is very opposite to that. What I understand.
It's conflicting. Double-minded is
Conflicting.
conflicting. Conflicting mind. One mind says do this. The other mind says conflicting. The will is double, what we can say, in 2 parts. One will says do it. The other will says don't do it. So he is in a conflicting state of mind. the will is distributed in two phases. One mind says do it, the other mind says it's a conflict of the mind. While in
And all the
ignition,
symptoms better by lying on the abdomen, sir. Is it okay?
no, lying on abdomen, no. All the symptoms are better by eating. Anacardium is better by eating. While conflicting emotions are what? Which is the remedy for conflicting emotions? The emotions are conflicting. What she feels emotionally is totally different. Ignatia. There you have conflicting emotions. My child is dead, but my mind says she is not dead. The emotions are at conflict. Here the mind is at conflict. Are you getting the difference?
Yes, yes.
One mind says, I have put the version off, the gas off. The other mind says, no, no, you have not put it. Go and see it again. So there is a difficulty in memory, short-term memory. You have put the lock, but the other mind says, no, no, you did not put the lock. You goes and checks again. That is anacardia. Better by eating. They have a band-like sensation, clutch-like sensation. There is a band-like sensation everywhere. Maybe in the head, maybe in the body. Band-like sensation. Something has blocked them. Something that has holded them. And they become very hard. Many times they become very hard. And because their mind or will becomes hard, they can do anything. If the child has done some mistake, they will take a stick and beat the child black and blue. And when they come back to senses, they feel so sorry and they say that I'm sorry, but at that time, at that verge of time, they are unable to understand what they are doing. They can kill people in that particular state of mind when they become very hard. That is hard-heartedness of anacardium, which is very similar to wood-like sensation or in aurum metallicum, wood-like sensation. So anacardium has two wills, conflict of wills, two wills. The exact word is two wills. One will says do it, the other will says don't do it. Better by eating, very hard and very violent. He becomes very violent. And then you have the other things of anacardium, which I have told you. But these are conflict in wills. And conflict of emotion is ignatia. Now, if you go, scrofulous persons are tubercular persons. Here are iode, calcare iode, hepar. So what I want to narrate from this or show from this is these sub-rubrics are important. In that sub-rubrics, if there are more sub-rubrics with single mark, then you have to be very, very cautious. Like you see here, eczema in psoriasis form, like very close to psoriasis, tuberculinum is there. So you see how things move. Eczema fissures with, again, tuberculinum. Here you see in all these, tuberculum is the only remedy. Eczema fissures with tuberculinum, eczema dry tuberculinum, eczema oozing tuberculinum, eczema painful tuberculinum, eczema red looks deep tuberculinum. You see? So many things are there where understanding your rubrics, understanding your remedy will make your cases more easy, more clear. And now in such cases, you have to go the other way around. When you are seeing tuberculinum, now you go back to the case and see what are the things of tuberculinum in this case. Who can tell some symptoms of tuberculinum? Yes, few symptoms of, strong symptoms of tuberculinum. Hello, the whole 16 group is very silent. Silence is not very good.
Sir,
It's psoriatic remedy.
patient
It comes
is
and goes.
despondent.
One after another, please. Yes.
It's psoriatic remedy. Mainly symptoms appear sudden and go suddenly. Is it
Okay? What else?
They're susceptible to weather changes.
Yes. Very good. What else?
emaciation is there. मतलब
Emaciation.
पतलापन होता है बच्चे में. हाँ.
Okay. What else?
Hyperactivity.
Hyperactive child. What else?
So sensitive to cold.
Sensitive to cold.
Easily tired and weak person.
No, tuberculum is quite strong.
Okay.
They're not tired easily. They are more hyperactive rather. The other.
Their fear of animals. Fear of
Which animal? Which animal?
I think
It's
so.
very,
Cats.
very
Yeah.
clear. Fear of?
Cats or yeah.
Fear of cats and dogs.
Yes.
Both. Fear of cats and dogs. Both.
Yes, sir.
And it's sensitive to fur of cats and dogs also.
Okay.
Right? What else? Very good. Keep going. Some more.
Redness of the area.
Redness of the area. No. It's a common symptom.
Yeah.
Biting nails, lying on the abdomen, desire for fat, desire for bananas, desire for cold milk. You see, you have to go very strong symptoms for those situations. Change of weather is definitely there. Family history of tuberculosis or family history of asthma. Tuberculinic constitution. What do you mean by tuberculinic constitution?
Thin, emaciated child.
Yes.
Thin, emaciated child.
Yes, correct.
What emaciated child, he eats well, but he remain emaciated or enlarged glands is there.
Enlarged glands, yes. Enlarged glands, mostly which glands?
The tonsils and
cervical glands.
Cervical glands.
Cervical glands, mostly cervical glands. What else? Desire fat on meat. Desire fat is very strong. Desire fat. And one more. Which type of meat does tuberculinum like? Smoked meat. Smoked meat. If you see the rubric, desire for smoked meat, causticum, tuberculinum. Causticum is also there. Tuberculin is also there. Causticum has desire for salt. Tuberculum will not have desire for salt. It has a recurrent otitis. Tuberculum will have recurrent colds, recurrent otitis. Grinding of sleep during sleep is very strong. So these are things. And lying on abdomen, sleeps on abdomen. Last time we talked about sleeps on abdomen is again tuberculinum. So you see, you have to many a times go through this repertorization, and then you will see that things are more better. Petroleum is one of the remedy which comes up. Summer amelioration. What is petroleum? Summer amelioration and winter aggravation. All the cracks, chaps, dryness of skin, they are aggravated in winter. But how will you confirm petroleum? Any symptoms of petroleum? Yes. Petroleum will have what? Apart from skin sensitivity in cold weather, that is very strong. Every cold, each year when the dry cold season comes up, the
deep crack. Deep crack. Petroleum is deep cracks. Deep crack.
Cracks, dryness, deep cracks, dryness, even dryness of skin.
Painful cracks.
Deep cracks, but this seasonal variation, every season of cold, there will be skin situation coming up. Deep cracks is the hallmark of it. What else?
Painful cracks.
Yes, yes, deep painful cracks, bleeding also.
Yes.
One is deep painful cracks, which are only mostly coming in winter. Second is car sickness. They have vomiting or nausea when they are riding in a car. The third is acidity. Petroleum will have a lot of acidity, gastric reflux, acidity. So these few symptoms, if you ask, car sickness is a hallmark for petroleum, then you go ahead and you confirm your remedy. So these are small tricks you have to play when you have to understand or go understanding the case or to distinguish between one remedy to another remedy. Okay. Now finished, I think. Discharging. Vaccination from Suja is there. You have those. They're coming up. Now, any more questions? Tell me. Put your questions now. So the whole inference from what we have discussed today is we don't have to be frightful of the disease, maybe psoriasis, maybe eczema, maybe lichen planus, maybe whatever the name of the disease is. What is we are more interested is in the symptoms that the patient is presenting, the quality of symptoms, the intensity of symptoms, the modalities, and the generalities of the patient. If you are able to understand that very clearly, then I think there will be no difficulty in treating any cases that you have in hand. It may be anything. The diagnosis is least important. Sometimes you need a remedy from the diagnosis point where we say this is a pathological case or we give a pathological remedy. It is there. But this is the basic understanding one should have, and our differentiation of remedies should be much better. Once you start understanding the differentiation of remedies, then you see that you will clinch the remedy very fast. So this is how you have to, after the analysis and evaluation, you have to clinch or come to one remedy. If there is a group of remedy, you can come to remedy by asking some few peculiar symptoms of that remedy and then finalize the discussion. Okay? Now your questions and answers, please.
Anyone having any doubts, please, or any questions, either put straight or you can put it in the chat box.
Only 12 people remaining. Yes, any questions?
Dr. Hiralal, good evening to you.
Yes, good evening, sir.
Ashok is here. I just want to ask that it happens, especially in the summer season, the people who are perspiring, sweating, the foot inside the toes, there are white coming out, you know.
Yes.
And it is very, very
Chilblains.
Sometimes there is a silica also when the smell is too much, and especially the socks are eaten by all this sweating. But still, I just want to ask what rubric, in case what we can take it to make us sure that everybody is not silica. But still, I have seen that many patients are suffering from this problem of the toes in between the white, and especially it becomes really too sticky. It's very difficult to cure. Please.
Now, first thing that apart from remedies, what they need is not to wear socks and shoes. They have to keep it open. The more it is closed, the more worse it becomes.
Yes.
Now, if you see, the rubric is eruptions, toes between.
Yes.
Eruption, toes between. And there are 33 remedies, sir. So, if you go through those, if it is eczema, it is fungus, it is silica. If it is herpes, it is alumina and graphites. If it is itching, if it is painful, it is sulfur. If it is a rash, it is Rescox. So you have to go through those 33 remedies, and then you have to decide what is the remedy for the person. Rubric, I will tell you. Remedy,
That's right. Certainly, I'm not asking question of remedy only, but question of rubric to understand where we will proceed having other modalities of the person.
Extremities, eruption, toes between.
Yes, okay, okay.
That
Thank
is
you,
the
doctor.
rubric. That is the rubric. And if you go through the sub-rubrics in that, then you will get more filtered remedies, what you want to see. And depending on the other history part, you can finalize your remedy.
Corruption. Thank you, doctor.
Right?
Yes.
Yes. Anything else?
I think there is no more questions from anyone. If there is any question which you want me to put to Dr. Hira Lal, please, you can either put it on the group after the class if there is something coming in your mind. I'll forward your questions to him, and then whatever sir replies, I will say the same to you in the group. Right now, if it is, if no one has any doubts, I think we can wind up.
Okay. Thanks a lot.
So
thank you very much, Dr. Hira Lal. Thank you.
So there is one question from Dr. Rita. What's the rubric used for extremities chilblains?
No. Chilblains, you will see chilblains directly. There is no rubric. You'll have to see the rubric chilblains as such. Chilblains, you'll have to see the rubric as chilblains. In chilblains, you have 114 remedies, extremities, chilblains. Directly, you have the rubric extremities, chilblains. And you have 114 remedies in that. Chilblains is a different rubric altogether. And in that, you have sub-rubrics more. In that, agaricus, pulsatilla, nitric acid, petroleum is there. And what we saw before was extremities, eruptions, toes between, in between. So there are very close, these are all two close rubrics that you have to look for. Chilblains is a diagnosis, while eruption is any type of eruption.
Dr. Arora, I have one more question to ask from Dr. Hira Lal.
Yes, please.
Please go ahead.
Thank you. Dr. Hira Lal ji, I have a patient, but the patient is not very easy. He had an operation in India and from other hospital of hernia, abdominal hernia. And after this, for a long time, it's already, I think it's about 1 year, and it is discharging. What he did, that having some knowledge about this biochemical remedies, he took Cilicia on the advice of someone or himself continuously. I was very surprised that he's taking on repeating Cilicia for 6. Certainly, what I thought, Cilicia repeating and repeating discharge will not stop it. So I thought it, this is my idea, but it's a question to you that we might be thinking to give him a higher potency as Cilicia we do it or hypersulfur when there is a discharge. If a lower potency, then it is to take out the discharge to continue. If we give the higher potency to stop it, the Cilicia, please verify this thing, how he could be helped about that. Cilicia, he took it in BO 6X.
Now, Dr. Saab, this case, post-operative, this can be a fistula that has occurred there.
Yes.
So it's a fistula post-hernial surgery.
Yes.
Now, where the tract is, how long is the tract? If you do a fistulogram, you will understand how long in the intestine the tract is going from or going
Mhm.
into. One, you have to confirm that mostly it is 90% or 99% fistula only. Now,
Yeah.
treating this as a fistula, we will have to see if silica is the remedy
Mhm.
and it is helping in lower potency. Silica is the remedy means the whole totality, not only just the fistula. In fistula, we have calcarea salve, silica, surina, many remedies are there.
Yes, yes,
So
of course. Yeah.
basically this started after a surgery. Okay.
Yeah,
For
after
the
surgery.
after a surgery. So here the causative factor has to be taken into account.
Mhm.
It was a clean-cut surgery. Okay.
Yeah.
So
Yes.
first remedy that I will start with is area. Because it started, the cause is surgery, and after post-surgical operations, if the things are coming up, the first remedy that I think is area.
Yeah. Normally we do it for 200.
Yes, 200 or 1M. Now, how long this surgery happened, depending on that, 200 or 1M you should give. And wait,
Yeah.
you should not give any other remedy except placebos. No
That's right.
biochemics, no 6X, no 3X, no 30s.
Okay.
Judge for the patient the type of discharge, the oozing, what is the type of oozing? It is offensive, it is plain white, it is pustular, it is pus in it or blood in it. The type of discharge will give you the further remedies. But the first remedy should be area because the cause itself is surgery.
Certainly. That's
And
right.
then the second remedy will come up. Maybe even causticum may come up, which is a complement of area.
All
Okay.
right. We will do. Then I will let you know about that. Thank you, Dr. Hiralalji.
Thank you. Thank you. Thank you. Thank you. Yes. Anything else?
One question is there, sir. Fistula. The patient has done the what I say MRI of the hip or that to assess the grading of the this fissure problem. So now he's saying the tracts are deep and it is filled with pus only, and no blood is there now. And the patient is now 60, 70 years of age, and there is recurrence in fistula problem. Like in May 2022, he also got the same thing. He cured by he was treated by me, and now I was also treating him. But now again, two fistula come up. So what can be the prognosis, or what should I advise him, surgery or give him any other medicines?
The first difficulty here is the age. He is already 70. So the regenerative capacity, the healing capacity becomes very low in these cases. One. Second is whether he is rule out diabetic. If he is non-diabetic, that is one good part of it. But definitely old
No
age.
diabetes.
So that is a good part of it. But old age itself, because the skin becomes lax, there is the healing capacity of the skin becomes very less. So here what you have to do, along with the remedies of fistula, the general remedies, the generalities of the patient, the aversion, desires, chilly, hot, you have to add old age and non-healing wound. Add to this non-healing wound, skin healing late or wounds not healing. Add that rubric to
Okay,
it and
this
see.
rubric.
Yes, add that rubric to it. Add old
Okay.
age also, because these are the complaints of old age, and you have generalities, difficulties or old age. You have to add this old age, wounds not healing early,
Okay.
and
Okay,
then
sir.
see what
Thank you.
happens. You have to have these two rubrics added to what you have added before.
Okay.
Surgery
Thank
will
you.
not help, it will make him more worse. Be careful.
Okay.
Yes. Anything else?
I think no more questions. I think we'll wind up now.
Good.
Thank you, sir, for lovely session. After hearing you, I feel my knowledge of materia medica is literally zero.
I'm also still 0.
No, sir, you know so many keynotes and everything, how to differentiate each medicine. Yeah.
The differentiation is important. We
Mm.
should start differentiating. We should read remedies and start differentiating. I think that is the only way we can remember materia medica, and very easy for us to immediately clinch the remedy for the patient. Otherwise, we are just entangled in the whole of the matter. ये भी आ रहा है, वो भी आ रहा है, वो भी आ रहा है.
Very true.
तो चालनी कैसा करने का, चालनी लगाइएगा. चालनी कैसा लगाना है वो सीखो. Homeopathy is easy. Homeopathy is easy only when you try to filter and differentiate one remedy from the other. That is the only difficult part with homeopathy. We should know that is the hallmark of that remedy. Graphites, very thick skin. If you see the neck, it is so thick. क्या मिलाते कि नहीं बच्चे को आप ऐसा रगड़ के निकाले तो बहुत सारा निकलेगा. Thick skin, elephant like skin, ऐसा बनेगा उसका. Don't see anything. Just give graphites. 10 ml for negative.
Okay, fine. Thank you, sir, and good night,
Very good.
everyone.
Thank you everybody for being so late. It's 10:30. Everybody might be hungry. From 17 we came to 10. So,
Fine, sir. Yeah.
it's good. Fantastic. Chalo, all the best. Thank you. Thanks a lot.
Thank you, sir. Thank you.
Thank you, sir.
Thank you, everyone.
Very much. Thank you very much, Dr. Hira.